Hi, I'm Linda and I'm a vet who works with Pooch Mutt, and today I'm making a video all about dogs and their dental health, and hopefully some of you guys will find this useful. The first thing I want to tackle would be some common myths, and these are things I hear in my practice maybe once or twice a week. Really commonly held misbeliefs about a dog and their teeth. One of the first ones is that a dog will not eat when their teeth are sore or when they've got any sort of dental disease. And this is really far from the truth. Dogs will continue to eat even with advanced dental disease, and even with severe dental abscesses and fractured teeth. They will still eat. Our dogs love their food and they know that to eat is to survive. So I think it's really important that people understand even if their dog's eating, they could still have a lot of problems in their mouth. Another commonly held misbelief is that a young dog can't suffer from dental disease. And I completely understand, why people would think this. It would be uncommon for a young dog of, say, 6 months or a year of age to have dental disease, but it certainly happens. Whether it's that they've got retained baby teeth and then food is getting stuck in between the baby tooth and the adult tooth, whether they've maybe fractured a tooth, or sometimes dogs just have bad genetics when it comes to their teeth and they're more prone to getting dental disease and gingivitis early in life. Another commonly held misbelief would be that dogs don't need to have their teeth brushed. And again, I really understand why this is something that people think. I know when I was growing up, we never brushed our family dog's teeth. I didn't know anybody who brushed teeth. I probably laughed the first time I heard about a dog getting their teeth brushed, but actually it is something we should be doing. And this is something we can introduce to our dogs from very early on when they're a puppy. And it's probably the best thing we can do to keep their teeth in good health. How often do we need to do it? About 2-3 times a week. And I know when I say that to people, they kind of go, "Oh, that's disgusting. We brush our teeth twice a day." But actually, really, as long as we're brushing it every 2 days or so, we are removing that buildup of plaque and we're preventing the calculus from forming. And if we're able to do it that often, it really is the best thing we could do to help to prevent dental disease. You can just use water, and it's the abrasive action of the toothbrush that's getting off that plaque and that buildup, and also old food. You can also use doggy toothpastes, and these are good because they make it a more pleasurable experience for the dog. Obviously they taste quite nice, so it's a bit of a reward for the dog as they're getting their teeth brushed. So obviously alongside toothbrushing, or sometimes in place of toothbrushing, because I appreciate that not everybody is able to brush their dog's teeth, would be dental sticks. And dental sticks are really, really good for dental health. And Pooch Mutt have 2 really lovely dental sticks. One is a calming one, which is the one I give my dog because he's a little bit loopy. And it's really nice. It's got hemp and sage, and it just helps to have some calming effect. And actually, chewing is quite calming for a lot of dogs, as is licking. So things like snaffle mats and lick mats work really well. And then also you've got this nice minty one, and the mint one, I'll just show you. It's green, which I think is kind of cool, but also it smells really, really nice, like actual mints. What's great about these, they're so firm, and so your dog's getting a good munch on them. He's really, helping to break off any plaque on the teeth, or any calculus on the teeth. And they've got nice deep ridges, which is perfect. So the teeth kind of go in between the ridges, and that brushes the plaque and the food off the surface of the teeth. Dental sticks are really helpful when it comes to fighting dental disease. One thing I'm often asked is how often should a dog have an anesthetic and a dental cleaning? And it really depends on the dog. And so this is something your vet will be checking for it when they check your dog's teeth at annual health checks. Are we at the stage where we need to do this? For some dogs, they might never need one if they're genetically, not prone to dental disease and we take care of their teeth. Whereas some dogs might need them 2 or even 3 or 4 times in their lifetime. This will be more common in certain breeds. Sighthounds are prone to quite bad teeth, and so are very small dogs like Chihuahuas and Jack Russells and Shih Tzus. The thing is, if they're needed, they are needed, and delaying a dental can result in worse dental disease down the line and a need for more extractions. So if your vet's recommending a dental, it's definitely something that we should go ahead and do.